Hello, I'm Dr. Ben Howder with Salt and Light Direct Primary Care in Petersburg, Illinois. I wanted to go over some questions that I commonly get from patients. The first question is patients commonly come in and are looking to learn more about direct primary care, and they ask, why would I pay for a direct physician patient relationship on top of what I'm paying for insurance? They're considering that they are going to have to pay more. And let's go over some of the insurance costs related to Blue Cross Blue Shield to see if they would actually pay more. So inputting some generalized data, I created a healthy male of 40 years old, and I like to call this generalized information Dave so that we can refer to him. So using that information, Blue Cross Blue Shield provided 11 different plans that Dave could use for his healthcare. On the left is the kind of entry level bronze 701 plan, and to the right we have the what Blue Cross considers the top tier gold 204 plan. On the far right, we also have a health share, which would be an alternative to using health insurance to mitigate costs of healthcare, as well as that direct primary care with the health share relationship. So this different graphs go over a healthy year of what Dave could experience. A healthy year is described as having 2 preventative office visits with his doctor and getting some generalized labs. Having no ER visits, no urgent care visits. These are the costs that Dave would incur. So the blue of the graph is what Dave would guaranteed to be paid, guaranteed to pay to the insurance company and the health shares due to the deductibles of the insurance. This is what you pay monthly to the insurance companies. The red is the extra that Dave would pay before he meets his deductible, and then the yellow would be what the insurance would pay. So using this, we see that the best deal that Dave could have in a healthy year of seeing only his primary care physician twice and getting some generalized labs would be just to have the direct primary care, but to mitigate further costs, the direct primary care and combining that with the health share would be the next ideal choice. Further, we can see if we add the direct primary care cost to the insurance, what that would look like. So we can copy that direct primary care price and add it to the bronze PPO 701. And we see that Dave would actually save $600 that year of a healthy year by adding it to his basic insurance plan. We can extrapolate this to the other insurance plans. And if Dave wanted to pay more in monthly premiums, he would still be saving at least $150 each year he has a healthy year by adding a direct primary care relationship to his already Blue Cross insurance plan. All right, so that was just for a healthy year. But what if Dave really needs to have surgery or gets really sick, needs to see specialty doctors? What would that look like? So having what I would refer to as a regular year, where Dave gets his 2 preventative office visits with his primary care doctor, gets some preventative labs, but he also gets sick twice. And using the traditional system, Dave would have to go to an urgent care in order to get that acute care and receive 2 acute prescriptions. But with the direct primary care model, he can get directly in with his physician and receive care that way. So if we similarly copy that direct primary care price of $930 that year, we add it to the bronze 701 plan, and Dave would actually save even more money of $1,280 that year of a regular illnesses type of year. We extrapolate that to the other insurance plans, and we see Dave is saving at least $240 by adding it to his insurance plan. All right, in a medically catastrophic year where Dave has multiple ER visits, multiple urgent care visits, CT scans, x-rays, seeing his primary care doctor 5 times, 3 specialty visits, lots of medications, what does it look like? Well, in a year where you meet your out-of-pocket max, which is usually around $9,000 on top of your premiums that you're paying to insurance, then the cost of having the direct care kind of becomes moot because any savings that you would get from the direct care, you would delay your out-of-pocket max for your insurance company. We can see that the highlighted light green of the direct primary care column is showing a savings of over $900 just for those ones. In fact, you save over $900 in all the insurance plans except for the topmost tier, where you save your $900 in just the labs alone. So if Dave wanted to add the direct care service to his insurance plan and only get labs, he would still be money ahead. So other patients claim that the employer pays their medical insurance, and this is somewhat true. If the employer similarly provided a payment to your mortgage by taking money out of your paycheck and mailing that to the bank, you wouldn't necessarily consider that paying your mortgage, that your employer paid your mortgage, because that was money that was already earmarked for you, and they just were kind enough to take it before they handed you your paycheck and send it in on your behalf. For more information on ways that you can develop a great relationship with your doctor, in my opinion, get excellent quality of care and perhaps improve the quality and possibly even save you some money, as we discussed, you can contact me directly at 217 393 8203. Thank you.